面对突如其来的新冠肺炎疫情，我们坚持人民至上、生命至上，坚持动态清零不动摇。
我们要吃饭，我们要上班，不要活在要自由。
最大限度保护了人民生命安全和身体健康。
For 3 years, China's state media was devoted to demonizing the virus. They could have used some of these vaccine mandates to push vaccination rate up. China didn't want to do that. The moment they wanted to bring down that intensity of those COVID-0 measures, they could not control that situation because the virus spreads too quickly. Millions of people were infected overnight. China's COVID-0 policy is what public health researchers call the elimination approach. They perfected the strategy of isolation camps, mass testing, really removing the infected from communities and tracking people's movements. Another thing that they did do very well was that they were able to control travel, and for about 3 years, there was no free global movement in and out of China. This is a hugely resource-intensive strategy. We didn't see that strategy really be successful in lots of places because that spread just happened so quickly. Most countries did not have the resources to do that. What we sometimes forget is that by sort of mid-2020, China was pretty much virus-free. It was the rest of the world that was inundated with spread at that point.
A lot of cities and compounds were locked down for a period of time, including mine. We were told that it was going to be 4 days. 4 days rolled into a week, and I was running out of food. So I think that the biggest concern of a lot of people was, number one, fear of the unknown. Luckily, I wasn't able to go to these centralized quarantine facilities. Some of my friends did. It was just mayhem, just rows and rows of beds, one bathroom for thousands of people. I watched these videos and I said to myself, my God, this is the last place I would want to be. So I got to avoid testing positive at all costs.
The policy worked really well for China until it didn't. There were major things that happened. The mRNA vaccines. Those vaccines were such game changers for the rest of the world. Like in the US and the UK, get all of their old people and vulnerable people inoculated first, and then get back to life as normal. China didn't do that as quickly. Their homegrown vaccines were also not as powerful. And the second thing that happened was that the virus evolved to just become so much more transmissible than before. It started to be a situation where you could not preempt its spread. It forced China to do more and more ridiculous things.
I heard about young children testing positive and the parents testing negative, they'd be separated. And also, let's say you have pets. For a lot of people, pets are family. There were some horror stories about, these dabais, these folks in white outfits, I guess you could call them enforcers, killing people's pets. And in the meantime, people were losing their jobs, the economy was tanking, the West was opening up. But it seemed that in China, we were sort of living like it was 2020. It didn't seem like we were trying to exit COVID-0. We're sort of knee deep in it, and this would be around forever. And it was very frustrating.
China knew that it had to exit COVID-0, and there was definitely a recognition, some groundwork being laid for that. The moment they realized how angry people were and how much economic damage there was, they wanted to bring down that intensity of those COVID-0 measures. But what happened is that the virus, as we've seen in so many other places, just took over too quickly. In that first week of December, Friday, it was COVID-0 China. Monday, every single person we knew on the mainland was infected or knew someone who was infected.
I went to one hospital, Tulare Hospital, and I walk in, and there were like a dozen ambulances outside the emergency room, bringing bodies into ICU. I go inside, and I'm left side is the ICU, and it was just jam full of people and ventilators, mostly older people. But there's just so many people that had to bring some of the people in gurneys into the hallway. And then I asked some of the doctors what was going on, and yeah, he confirmed that these were all COVID cases. It was quite alarming, given the fact that a week earlier, things were pretty quiet.
I don't know whether anyone will ever get an accurate idea of what the death toll in China is. They put out a number, 60,000 people have died in hospitals over the 5 weeks since the reopening. But that's only in hospitals. And it's definitely a fraction because most people are dying outside of hospitals at this point. And the only way really to get that accurate number is going back and looking at the death toll for this period compared to a normal year. And I think we can assume all of that extra is due to COVID. But there is an official unwillingness to grapple with that reality because China's entire ideology and narrative for so many years was that its approach was superior to the rest of the world, especially to Western systems. The thing with China is that because of its political system and the way its society is designed, it can appear to be very stable and calm and controlled. I think the COVID crisis really revealed to people how quickly that image cracks into a million pieces when you have so many people experiencing a huge change at once.